Good morning, Graham. Nice to see you. Nice to put a voice to the
To the
face and
face.
these the
Yeah,
the social media
yeah.
communication.
Yeah, it's the power of social media. I love it. I've honestly met
Well,
loads of people this way. It's brilliant. Yeah,
oh yeah,
LinkedIn.
lots
Yeah,
lots of conversations with people from all around the world, Europe and United States,
yeah,
and also around Australia as well.
yeah, yeah,
Um,
yeah,
so that's one of the really cool things about social media. I
yeah,
describe social media and the internet a little bit like Star Wars.
yeah,
You've got the dark side and you've got the force.
yeah,
There's
yeah,
anything that is so powerful also has a sinister side.
yeah. There's the bad side of
And
it, definitely. Yeah.
yeah,
So
by definition, mate, by definition, anything so powerful and good has to have an evil aspect of it. And obviously, the internet can be very evil as well.
yeah, yeah, yeah. As I know from the past, yeah, I'm very, very careful what I post now, what I say. Yeah,
Yeah.
you've got to be.
Well,
Yeah, but
well, apologies that I've got had to squeeze the conversation in
no, you're
on my
fine.
way to work.
Honestly,
But
yeah, honestly, you're fine. Like I say, I'm using a free Zoom account now because to be honest, I only use Zoom about once every 3 months. Um,
yeah,
so I used to have a pro account for like longer conversations, but a few minutes is fine. 20 minutes, whatever. Yeah, it was just
yeah,
basically just a little bit of chat about, get a bit of information about yourself and ask me anything.
yeah,
Just sort of talk about back pain, different approaches, and what you do, what I do. So obviously you're a surgeon, you're medical, you're a complete different level, to me with like knowledge and things.
yeah.
Sam,
Well, we all um back pain. The most important information about back pain is not the highfalutin,
mm,
cutting edge, pointy end of the spear,
mm,
modern medicine technology.
mm,
It's really the most basic stuff that every single clinician, physical therapist, general practitioner, exercise personal trainer
mm,
should know.
mm,
And it's my belief that if that simple basic knowledge that we can all possess
mm.
is well understood, we will cure the epidemic of low back pain.
Yes, yeah,
The only reason why I'm in business as a surgeon is because the 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 normal corner store physical therapist is not doing a good job.
no, no, yeah,
That's it.
yeah,
So when you talk about being a surgeon, like my skills and knowledge as a surgeon is the least important aspect of back pain management.
yeah,
It is absolutely like the 0.001% value.
yeah, yeah,
But
yeah,
the only reason I have a business and a surgical practice is because the industry is really, really bad at just looking after little old back pain
yeah,
that, as we know,
yeah.
affects such a huge proportion of society,
It does.
and is
Yeah.
classified as the leading cause of disability on the planet.
Yes. And this is what
Um,
I found in the UK because a lot of people are actually frightened to get help for back pain because they think they're going to end up under a surgeon's knife. Like, and I keep
yeah,
saying, well, those cases, in my experience, are
mm,
very, very slim. It's very slim. And most cases of back pain end up leaving a doctor's consulting room without an actual diagnosis because they say you need exercise, you need a bit of a
yes,
lifestyle, change. Um,
hmm,
and prevention rather than anything else. And
absolutely,
like
absolutely.
exercise. Exercise. It's what I do is very, very basic. It's functional movement. Um,
Yeah, tell
Squats.
us tell us a little bit tell us a little bit about your practice, Graham, so that I,
Yeah.
I know
Well, what I do
where you're
is,
coming from.
yeah, yeah. Well, how I do it is because I don't operate out of a gym. I've been in many gyms over the years, but my business right now is mobile exercise sessions. So I'll visit people's homes, occasionally the workplace, and I'll do a lot of outdoor sessions as well, not just for back pain, but general PT.
Yep,
And so I
yep,
use portable gear, things like resistance bands, things like a kettlebell, things like
hmm,
yoga blocks that are very useful for stretching as well. And it's a 1 hour session, typically at somebody's
Yep.
home. It could be in the
So
basement.
you're doing one-on-one
One-on-one.
meetings with people as
Yeah,
a mobile functional
yeah,
therapist, functional movement
yeah.
therapist.
Just more mainly 1-to-1. I sometimes do 2-to-1. It depends.
Yep.
You know, I get diabetes clients as well. People who just want general
Yep.
fitness, but would get the back pain.
And where does your skill set stem from? Where have you gained the knowledge to deliver
Um,
your methodology?
um, right, going back over 30 odd years, I began in Thai martial arts. That's where I got an interest in fitness.
Hmm.
Sort of looking after your health and things like that. I thought, wow, because I had quite a good body on me then. I thought, wow, this is incredible. And over the years, I got more and more interested in more of the science, the anatomy side of things. So I then began in sports science at college. I was only about 19. I did a 2-year national diploma. That was supposed to take me to university, but that never happened. So I started doing all kinds of different jobs, but I kept the fitness as
Hmm.
a hobby. And then
Hmm.
I became a gym instructor, then a PT. Then I went
Hmm.
into GP referral, which is now called exercise referral, which is where
Hmm.
you essentially that qualification is to deal with health conditions, which include low back pain at a basic level. And then after that point, in the last 2 years, I went to what we have in the UK, which is a level 4 qualification. So that's like the highest level within the fitness industry, and that allows you
Yep.
to specialize in specific health conditions. So 2 years ago, I got the low back pain one and lifestyle management. And then just a few months ago, I passed the obesity and diabetes one, which includes all the nutritional stuff for health conditions. So it's that the way I look on it is it's that bigger picture. It's not just dealing with, like, just say it's back pain. It's not just the back where it hurts. It's the whole body. The whole body is how I
Yep.
approach it. And
Yep.
it works, it really does work. Um,
Yes. It's very interesting. It's interesting that you say you come from a background of martial arts, right? Because there's a high level of skill involved in the movement
mhm,
of your body whilst expressing martial art
mhm,
techniques.
mhm,
Okay, and the penny that dropped for me as a surgeon, when I started treating the cause of back pain, was understanding that there is a skillful and a correct way to move the lumbo-pelvic spine
yes,
in daily life activities,
yes,
and an incorrect way to move the lumbo-pelvic spine.
mm, mm,
And I acquired that little light bulb moment just serendipitously because I took up the sport of Olympic weightlifting.
wow, yes, yeah.
Okay. And Olympic weightlifting, the people who are the best at it are not necessarily the biggest and strongest and muscliest.
No, they're not. Yeah, yeah.
They can be the smallest person in the room,
Mm,
but they just have very good coordination.
yes,
Okay. And
yeah.
it really is about coordination of the lumbo-pelvic spine,
Hmm.
right? So once I started doing Olympic weightlifting and realizing and looking around the training room and talking to my coach and getting better at Olympic weightlifting, I started to realize that I was developing motor patterns
Mm,
in my own body that would parlay into daily life activities, that would parlay into the way that I bent over to brush my teeth, the way that I bent over to stand up and sit down, or to empty the
yes,
dishwasher, or to pick
yeah,
up the grocery bags.
yeah.
And my whole spine started to move differently. I could feel my posterior chain starting to wake up and get healthier.
Yeah.
And previous things that I thought were soft tissue tightness and restricted hamstrings and sacroiliac joint
Mm,
irritation, all of those things basically disappeared
mm,
simply by moving correctly in daily life activities.
yes.
And
Yeah.
I didn't do stretching. I mean, I'd done that kind of stuff before to try to
Mm,
help tight hammies,
mm,
But it doesn't work because stretching is not a qualitative management intervention.
mm,
It's a passive
mm,
um, quantitative intervention,
mm,
whereas movement proficiency, movement skill, movement coordination is a qualitative intervention. It's a qualitative functional intervention. And then it just like the penny just dropped, and suddenly all of the jigsaw puzzle pieces associated with back pain. And I had a good understanding of all the jigsaw puzzle pieces,
mm.
but I'd never kind of put the puzzle pieces
Put
together
it
to make the
together.
clear picture.
Yeah, yeah.
And once I started to get these penny drop, I basically was able to put this picture together, and then we came up with the concept that movement dysfunction of the lumbopelvic spine
I like
is
that.
a
Yeah.
functional, that is the functional disease that we need to cure,
Yes.
that causes the
Yeah.
back pain symptoms.
Yeah.
Okay,
Yeah.
it's no different. It's no different to if I'm driving this car badly because I'm functionally a bad driver. I'm functionally not skillful at driving this car. I will have a crash and develop an injury to the car,
Mm,
right? And if I have a skillful set of driving skills, I can safely drive this vehicle from A to B every day of the week, and
mm,
the car will be fine, right? And it's no different to my human body being the vehicle. If
mm,
I can drive my human body correctly,
mm.
then my human body will not sustain injuries.
Yeah. Yeah.
It will still get older, it will still
Yeah.
degenerate,
Mm,
but degeneration is a normal, healthy, pain-free process.
mm-hmm. Mm,
Okay. And that's what a lot of people misunderstand is they think, oh, my bulging disc or I'm old, so it's normal to feel pain. No, that's incorrect.
yeah.
It's
Absolutely. Yeah.
degeneration is pain free,
Mm,
but degeneritis is painful.
yes. Yeah.
And it's the inflammation that occurs in your aging joints that is what makes you take a Panadol or a anti-inflammatory. And
Mm,
the reason why the inflammation develops is because you're not driving the vehicle correctly.
mm-hmm. Mm,
Does that make sense? And
yeah.
so
Yeah.
movement dysfunction is the disease. And
Yeah.
and all good therapists have in their treatment toolbox functional movement therapy as part of what they
Yeah.
do.
Yeah.
Okay, so it doesn't matter whether you're a personal trainer or a chiropractic therapist or a massage therapist
Mm,
who's seeing someone with back pain.
yeah.
If you also can have the skill set of functional movement therapy, you add that into whatever you're doing that's personal and individual to you as a therapist, then you're going to make a meaningful difference to that person's life.
Yes. Yeah.
Okay,
And
and as a
yeah.
surgeon, I have in my weaponry functional movement therapy that
Mm,
I had as my first port of intervention. The surgery comes later
yeah.
if the patient reaches my doorstep a long way down the track and they haven't received the advice early.
Mm,
Okay, but if they do receive the advice early from Joe Blogg's therapist out there,
yeah.
I will have an empty waiting room. My waiting room of surgical patients will be empty because they'll
Yes.
never ever need
Yeah.
to, they'll never
Yeah.
need my surgery.
Yeah. And that's it. And
Okay.
because it's so true because I get nothing but good reports of the people who I teach, and they'll just come to you like 3, 4 sessions down the line, and they just said, "Oh, it just dawned on them. I've got no pain anymore." I said, "No, because we're doing the basic exercises, absolutely
Yeah.
basic.
Yeah.
I'll have to do lunges, squats, even shoulder presses,
Mm-hmm.
appropriate
Mm-hmm.
basic
Yep.
functional movement. Um,
Yep.
I do incorporate stretching only to a degree, but that's overall with general fitness, just overall
Yeah.
general health.
Yeah.
Some
That's just a
enjoy it.
little bit of sort of that's
Yeah,
just a little bit of
yeah,
accessory stuff on the
yeah,
side. But
yeah, yeah,
the real
yeah,
crux of your 1 hour session and our rehabilitation program is uh, 2 1 hour sessions per week
okay.
for 4 to 6 weeks. So they get
Yeah,
roughly 8 to 12 hours of movement therapy.
Yes.
Okay.
Yeah.
So that's where the bang for your buck is. It doesn't matter if just say you're an acupuncturist and you want to do 5 minutes of acupuncture, or if you want to do a little bit of stretching, or if you want to do a little bit of
Yeah. Yeah.
yoga.
Yeah.
That's absolutely fine.
Mm.
But the crux of what is making the patient truly recover from their degeneritis or their joint inflammation is the biomechanical upskilling
Yes.
of their lumbopelvic
Yeah.
biomechanics.
It's more efficient movement. And even
Yes.
things like mobility, every single person that I've had, I can't think of one has had really bad mobility. So I sort the mobility out. It takes time. We do the same
Hmm.
exercises from the neck to the ankle. Same thing with
Hmm.
most people. When they're
Yep.
moving, then I
Hmm.
introduce the functional movement. And that seems to work really well. But I always say we'll keep up the mobility as well. It's literally 5 to 10 minutes every session, sometimes at the
Yeah.
start, sometimes at the end. They can take that home, do it at home, every day before breakfast or before they go to bed. It
Yeah.
doesn't take much, but I said if you keep doing that, you'll always be able to do that, to some degree. I would say irrespective of age, to be honest, because it's
Yep.
not it's not um it's not difficult, you know. It's not technical.
Absolutely.
Yeah.
And so when you deliver those skills to your patients,
Hmm.
what you're effectively doing is you're training them to have a 24/7 rehabilitation program.
Yes. Yes.
Okay, because
Yeah.
once you leave,
Mm.
their premises, or they leave your studio or whatever it may
Mm.
be,
Yeah.
once our patients leave us,
Yeah.
they are leaving with greater skills
And
to
knowledge.
move their body,
Yes.
and knowledge, and greater skills. That
Yeah.
means that when they go and get into their car and they get out of their car, or they go home and they do the housework, they are moving with a greater level of proficiency. So they are actually rehabilitating constantly through the day
Hmm.
once they've left you. Okay, so that's what I mean by the rehab program is a 24/7 program.
Yeah.
It's not just, oh, come in for 1 hour and do some deep tissue release,
Yeah.
or do some adjustments, and I'll see you in 2 weeks' time
Mm.
when the pain's back again. When
Yes.
they come back again, they're just coming back for a more top up
Yeah.
of skill acquisition, or a
Yeah.
more top up of a refinement of the skills that we
Yeah.
taught them
Yeah.
in the previous session. And eventually they're at a level of skill that allows them to continue to progress along a trend line of improvement, until they've met a level of satisfactory functional capacity. And I'm happy. I can
Mm.
do the dishes. I can do the housework. I can do the gardening. I can go
Mm.
back to playing with the kids.
Mhm.
And that's really what most people
Yeah.
want when they come and see you, is they want to get rid of their back pain, and they
Yeah.
want to have a lifestyle
Absolutely.
that's
Yeah.
satisfactory to them. And they
Absolutely.
don't want to have a six pack. They don't want to
No,
be
they
Arnold
don't.
Schwarzenegger.
Yeah.
But most of the time when people go to Pilates, they walk out 6 months later with a six pack, but they still have back pain.
Yeah. Exactly.
And
Exactly.
they never asked for a six pack. But
Yeah.
they went to the Pilates studio to get rid of their back pain, and they walk out with this, ripped core,
Yeah.
but they're still moving like gollywogs.
Yeah.
So they still have their back pain
Yeah.
six
Yeah.
months
Yeah.
later, right?
Yeah. Yeah. I
And
got
so
a, yeah, I got a really nice review from one of my clients. She's coming back to me in the new year, but she actually said that she was able to put together some flat pack furniture at the weekend without any back discomfort. And that said to me, right, that's great. I've done my job. We've moved
yeah,
forward, and it's been great.
that's it.
Every session's been that improvement, stepping up bit by bit. Yeah.
Yeah, that's it. That's a quality of life gold medal. That's a
Mhm.
quality of life gold medal. That's like when I'm teaching Olympic weightlifting, that's like someone getting their PB 100 kilogram snatch
Yeah.
or clean and jerk.
Yeah.
It's still the same thing. Like, the only reason why that person was able to get their PB snatch or clean and jerk was because we refined their movement skill,
Yes.
that allowed them to build functional capacity, because you can't build functional capacity without first having movement skill.
Mm.
And so for your patient, you've refined their movement skill, and they then built functional capacity that allowed them to put together a piece of furniture from IKEA.
Yeah.
It's the parallels are identical. The fundamental principles that we're applying when we express functional movement and we cure back pain, they're identical.
Yes.
That's why it's so simple. That's why the cure for low back pain is so simple, right?
It's so simple.
And by definition, it has to be, because all epidemics have a simple and ubiquitous cause.
Yes.
Right?
Yeah.
That's why I hate that article published in the Lancet by Chris Marr and co, who and it's called non-specific low back pain. Okay, in the seventh line of the abstract, they blatantly state that there is no pathoanatomical cause for low back pain symptoms.
But we know there is. Yeah.
There has to be.
There has to be. Yeah.
Like in the first line, they say back pain is one of the leading causes of disability on the planet. And then in the seventh line, they say there's no pathoanatomical cause. So that is the definition. That is the definition of a freaking oxymoron. That and these are the people who are writing the guidelines for back pain care.
Yes.
Okay, so they have the blinders on.
Yeah.
Simply because they don't actually have the skill set to cure the problem. So rather than saying, we don't know what the hell we're doing, we'll just tell the world that there's no cause for your back pain. It just happens.
Yeah.
Right? Now, you imagine young, influential, young minds who are learning, easily influenced minds who are going through university, graduating as clinical therapists, that graduate thinking that there's no cause for back pain.
Yeah.
All they are ever going to do to someone is teach them pain management.
Yeah, and that doesn't cure it. That's it.
And that doesn't cure them. That's symptom-based management as opposed to cause-based management.
Yes. Yeah.
And I had a patient yesterday who did a pain program, a 4-week pain program that consisted of meditation and counseling and understanding pain science. And they were told that 4 out of 10 back pain is normal.
Yeah.
And they were like in their, mid-30s. They were told that pain is normal. No, pain is an evolutionary alarm bell that tells you something is
wrong somewhere. Yeah.
Correct.
Yeah.
And yet the industry has resigned its brain power to saying pain is normal. Just learn to live with it. Learn to manage it. You're not going to fall apart. These are elements of muddying the waters, because there are elements of truth in what they say. Like, you're not going to, just because you've got back pain doesn't mean you're going to become paralyzed, but you may not be able to kick a footy with the kids.
Yeah.
Right. Now that is miserable. That is miserable for most people. That is so disabling. And of course you then have the secondary effects on mental health, et cetera, and metabolic health.
Then it becomes a disability mind, and then suddenly, I've got a bad back, and then and this, sadly, right, this is the problem within the UK, because there's still a mindset out there of bad backs, that's it for life, and there's very few actually understanding, well, actually what you need to be doing is exercise, some form of functional exercise. Now, there's a lot of confusion out there. I tend to sort of rip through it in my mind, think that, ignore, right, I read that, ignore that. But there's often a promotion of things like yoga for back pain, but yoga is also known to aggravate low back pain for the simple reason the poses that are held for a long period of time can cause a hypotonic state in the muscle. There's been some research on that, so it can aggravate. It's like overstretching that you don't need to do. And ultimately the body has to be self-supported. It's got to be, the spine needs to be stabilized. You've got to build that strength, the leg strength, all the way up from your feet up to your head.
Well, it's See, there's going to be people who say, "Oh, well, yoga helped me a lot," and then
Mm,
there's going to be people that said acupuncture helped me a lot, and there's going to be
yes.
people that said,
Yeah.
"Oh, going to the gym helped me a lot," right? So what you have to do is you have to filter out the noise. You have to
Yes.
filter out the
Yeah.
confounders.
Yeah.
What is it? What is it about those three things that made the patient feel that they got better from that therapy? Okay,
Mm,
and this is where the breakdown in communication and definitions occurs. If if I sprinkle tea leaves on your back, right? If I sprinkle tea leaves on your back and your back pain gets better, you've got to ask yourself, is it the tea leaves that has made me get better? Or is there something else associated with the tea leaf sprinkling that
yeah.
made me get better? And that's where people's blinders come on again, and they don't realize that whatever therapy truly made someone recover,
Mm,
and when I say recovery, that means going back to quality of life, not just a lot of people who think that they get better, but they will never play golf again. Okay, so that's a fake getting better. That's not truly getting better. If
mhm.
you say my back pain is better, but I'm not doing this, this, and this, and I'm on a disability pension, but my back pain's manageable now, you haven't truly got better. That's a pseudo recovery
Mhm.
because you've recreated stability by doing nothing.
Mm,
Okay, functional demand and functional stability are inversely related. The
mm,
less I do, the greater functional stability I have. Okay,
mhm.
so that's a fake. When someone truly gets better, their functional capacity and their lifestyle activities is also maintained at a high satisfactory level.
Mhm.
So when I sprinkle tea leaves on someone's back and they say, "Oh wow, that's amazing! I'm back to playing golf and I'm back to running," and so whatever happened while I was sprinkling tea leaves on their back also improved their functional movement proficiency somehow, or whether it was serendipitously, um, and I increased their stability, their motion segment stability. So sometimes yoga and exercise, etc., patients will because remember, functional movement proficiency is hardwired in the brain.
Mhm.
Okay, so we do all have the ability to move well. We did when we were 2 years old. You know,
Yeah.
when we were a little baby picking up our Lego, we were moving well. But modern society will corrupt movement, and if you can serendipitously regain movement proficiency, you will kind of get better. You
Yeah.
will kind of get better, but don't attribute the recovery um, in your back pain simply to just the yoga. The
Yes.
yoga was an association with
Yeah.
you happening to start to move more skillfully.
Yeah.
Okay, and so it's the movement that actually made you better, not the yoga. The yoga was just associated with it, right?
Yeah.
And so therefore, I can deliver a whole lot of things
Mm,
that may, on the surface, look like that's making you better,
mhm.
but it's when you break it down, it has to come back to the biomechanics, right? And so the true therapeutic intervention that made the difference was the restoration of the biomechanics. But my suggestion to that is, well, why don't you, rather than hope for serendipitous restoration of movement, make that your primary target. Make the functional movement proficiency the primary
I'm ready.
goal,
Yeah. Mm,
and then you'll get it in 100% of patients, not just the occasional 5% of patients who
mm.
serendipitously start to move better again.
Yeah.
Right?
Yeah.
And so that's where the industry can get a little bit confused, because they say, "Oh, but I know that I've given some people yoga and acupuncture and taping and deep tissue release, and they told me that they got better." But
Mm,
that's like a random scattering of people, rather than
yeah.
saying, "Hey,
Yeah.
I'm going to give everybody movement therapy, functional
Mm,
movement skill acquisition, and now I'm getting 100% effectively, 100% of people getting better, not just this random occurrence of,
yeah.
because I can
Yeah.
guarantee you that there's 90% of people who do acupuncture and Pilates and yoga there's 90% of them that don't serendipitously fall back into good movement, and they will never get better. They will never get better.
It's got to be
100%
across, you know, the whole population, really, of that movement improvement, and you know, like
movement improvement. Yeah, I like that. Hey, that's a good little catchphrase. Movement improvement.
Use it, yeah. Use it. Movement improvement. You know, keep it simple. Yeah.
And Graham, I try not to. I know you've used the word exercise a lot, but I try not to. I try to stick with the term functional movement skill, functional movement quality, just so that people don't.
It gives it more clarity. Yeah, more clarity.
As clinicians, we've got to start using correct language. Like I'm a physicist or a mathematician, and I'm talking to someone on the other side of the world, and they can understand E equals MC squared, right? We're not confabulating. We're not using nebulous terms. Otherwise, our skillful communication as scientists can get muddied and watered down. And because we're not delivering exercise therapy, we're delivering movement therapy. Exercise therapy comes after the movement skill acquisition. Exercise is to build functional capacity. But before we do that, we have to lay the concrete slab that we then build. That's it, the foundations. And so try to get in the habit of using consistent terminology. And that's part of my course to become a movement therapist, which is a 5-day course where I teach therapists who want to get better at treating back pain. I teach them the language of movement theory. And then we can start to disseminate consistent discussions and consistent delivery of functional movement therapy. And then the other important definition that kind of is a roadblock to progression is clinicians don't have a clear definition of what we mean by functional movement, and they don't have a clear definition of what we mean by movement proficiency. And those are really important things that every functional movement therapist needs to understand as well, because otherwise they think, oh, but you can move any way you want. There's no problem. Movement is diverse. Movement is artistic. Movement is unique and individual to the person. What they're confusing there is non-functional artistic movement versus biomechanically universally consistent functional movement.
Which is the way
they're confusing artistic movement versus functional movement. Functional movement is very consistent and uniform. Artistic movement is diverse. Okay. Do you remember the Australian rapper who went to the Paris Olympics? Ray Gun. She made headlines.
Oh no! Tell me.
No, it was just a funny thing. Australia sent this rapper to the Paris Olympics, and basically she made up all these rap breakdance moves.
Okay.
Not rapper, breakdance.
Breakdance, yeah.
And her tag was Ray Gun. Anyway, but she was just an embarrassment. She was an embarrassment for Australia, because she basically nominated herself to go to the Olympics, and she made herself the judge and jury of who went to the Olympics as representing Australia in breakdancing. Anyway, her movement was artistic, and it looked like it was so hilarious. But that's artistic movement, and art is in the eye of the beholder. Yeah, that's diverse. Okay. But when you're talking about getting work done, getting work done in your daily life with functional tasks, which is a foundation of quality of life, I can do things. I can go to work. I can stand up. I can lift. I can carry. I can push. I can pull. When we are doing functional movement, there is a uniform, biomechanical, consistent set of rules that dictate that movement. And that's important for functional movement therapists to understand, is we're talking about functional.
It's the absolute foundation, isn't it? That's what it is. All right, cool.
That's it.
Yeah.
Does that make sense? Does that make
Makes
sense?
sense.
The movement theory. We
Yeah.
just touched the surface, but
Just
we're
touched it.
talking
Yeah.
about
Yeah.
the fundamental principles of
Yeah.
movement theory. And really, when you spend a little bit of time talking about it, you can never poke holes in the clinical model that we've created
Yeah.
at our organisation, which
Yeah.
you've probably seen on my post, Functional Movement
Yes.
Training Centre.
I've seen it. Yeah.
And I've labelled it Neurohab. Neurohab specifically because we're rehabilitating the central nervous system motor patterns.
Yes. Yeah.
Okay, that's why our program is called Neurohab.